Tin. My name is Salmai. I'm a FNP student. I'm going to exam you today. So first of all, tell me how old are you?
I'm 12 years old.
Okay, good. And first of all, I will look over. Okay, so I will observe your face. You look fresh and then happy, smiling, good, and your body is symmetry. Okay, and then equal, normal development and growth. So look good, and you look happy today. Okay. Now I'm going to take your vital sign. First of all, I'm going to do your blood pressure. Okay. Okay. So your blood pressure is 95 over 60, which is in normal range. Okay. And you take your pulse. Okay, your pulse is 78 in a minute, which is in normal range. Okay. So I observe your breathing rate. So in a minute you have about 16 times, so it's normal also. Now I know that your height around 5 feet 7 is mean about in the normal range of weight percentage is from 5% to 85%, which is normal range, and then your weight around 120 pounds is also in the range 5% to 85% according to your age is normal. So the BMI also in the normal range, so you're in a good shape. Okay, now can you open your mouth? I want to see your teeth. Okay, so you have 28 teeth altogether, which is normal numbers of your teeth, and your teeth status is normal. I didn't see any caries or any damage in there. Okay, and your tender, like pivotal development, I think you, after I observe examination on you, I think you're on the last stage 2 to stage 3. Okay, so now you what class, like what grade are you in now?
I'm in grade 7.
Okay, so what do you do in school? Do you participate in sport or any group of friends play together?
Yes, I do play some basketball.
Okay, very good. And then, so according to your age and your grade in school, so you're in the normal developmental, we call milestone achieved. Okay, and then your language development, you understand what I say and what you respond is very good. They call express this and understand to speak back to me. That's normal. Okay, for then Denver developmental school, usually they apply for the child less than 5 years old, so you already 12 years old, so we can skip that. Okay. Now I observe your skin. Your color is brown, and your texture is smooth. Okay, and you hydration enough. I didn't see any lesion or eruption on your skin, nothing. Okay, and I didn't see any scar. Let me see your nail. Okay. So your nail is shining, smooth, no lesion, and your hygiene is generally you groom me. Your hygiene of the nail is clean. Okay, so I'm going to do capillary fill is normal, usually less than 3 seconds. So you in normal. Okay, so now I have examination for your head. I see your head is the symmetry and the contour is equal. I didn't see any lesion, any deformity. And your hair, I touch your hair, okay? Your hair is distribution equal, and the texture is smooth and silky. And I didn't see any infestation, lice, or anything like that, okay? And for your head, if for the child less than 2 years old, I go to exam the fontanelle, but you already over, so it's normal, okay? Now I look at your eyes, okay? So your eyebrows on the end doesn't have any thinner, it's normal distribution eyebrow. Your eyelid and eyelashes direction is upward is normal. I didn't see any edema. Edema means swelling, okay? And ptosis, it means drooping, okay? I didn't see any lesion on your eyelid neither. So can you take off your glasses? Okay. Now I examine your conjunctiva. Okay. Look. Your conjunctiva is no pale, it's pinkish, and no pale, and no lesion, no discharge. And then observe your sclera. The sclera I see it on bulba and bumbibra is white pearl, no lesion, no hemorrhage, and no icterus. This means yellow color, okay? And then I observe your cornea is clear, no lesion, no scar, no arcus. Arcus means when we aging, everybody you are not here like this, okay? Now I want to test your light reflex. Just look at straight. Look straight, okay? I'm going to shine the light in front, right in the middle. Okay. Your light reflex is normal, equal to both sides, okay? Now I observe your iris, okay? Your iris is brown and uniform color in both sides, okay? And now I look at your pupil. Your pupil is, let me see. Your pupil is round, regular, equal to both sides, and let me see the side, okay? I'm going to see. Okay, I use the standard right here and measure. You have about 3 to 4 millimeter, which is normal, okay? Normal on both sides. Now, I'm going to test your pupil reaction to the light, okay? To do that, I'm going to turn off the light here. And then usually we have a direct reaction and consensual reaction. Direct reaction is mean when I shine the light on your eyes, the same eye pupil will constrict, okay? Consensual would mean when I shine at the left, the right eye, the left pupil will be constricted, okay? That's what we call consensual, okay? So let's see, we turn off the light, okay? Suppose we turn off. And then I cover this, shine on the side, look straight to me, okay? Okay. 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 So your constriction, reflect direction, and consensual normal, okay? Now you look at me, okay? Look on my wall behind me. Look at my finger. Look the wall behind me. So that we call accommodation reaction, which is also normal, okay? Now I'm going to test your movement of your eyes, okay? To do that, you look on my finger, okay? I'm going to move my finger on different direction. We call that is field of gaze, okay? Cardinal field of gaze. Look at me. I also observe if you have nystagmus or not, okay? Which you don't have. Sometimes people have about 1 or 2 nystagmus. It's normal. Nystagmus means when you move on the way to on the left or on the right side, it's to have a very quick movement of your eyes. So, but you don't have it, okay? So now I'm going to test your visual field and your visual acuity, okay? So to do that, can you cover with this one eye, okay? If you see my finger wiggling, just say yes, okay? Okay.
Yes.
Okay.
Yes.
Okay. Now turn another side.
Yes. Yes. Yes.
Okay. So your visual feel normal. Okay. Now to test your visual acuity, you also cover with your one eyes. Yeah. Now look at the lower line as much as you can.
I cannot see everything in the lower line.
The lowest you can see.
It's on the
Just read it.
ELT PH.
Okay. This is what.
This is PHLT.
Okay. So another side. You can put this one. Lower line.
LTFPH.
Okay, so after this, your visual acuity on the right side, you have a problem. Now you can put on your glasses. Okay, cover one eye. Okay, read the lower line you can see.
LTFPH.
Another side.
LTFPH.
Okay, good. So you, with the glasses, you can read normal 20/20. Without the glass on the right eye, you have a problem, which just 20/870, which means the normal people can read at a distance about 20 feet, but you need, 70 feet, but you just see at the 20 feet only. So you have the glass to adjust, that will be okay. But you need to see the ophthalmologist, the eye doctor, at least once a year, okay? To make examination. Now I'm going to use the ophthalmoscope. Can you take off your glasses? With this, I'm going to look internal structure inside the eyes, okay, through the cornea, okay. I use my right eye to examine your right eye, my left eye to examine your left eye, okay. So can you cover one eye? Yeah. I'm going to adjust my, okay. Look straight, okay? Okay, take another one. Okay, that's it. So with this, I see the red light on both sides. Red light reflect on both sides normal, which is normal, okay? So to do that, I look in through your cornea and will see the anterior and posterior chamber, the lens, the vitreous. That's the structure, okay? And then the fundus of the eyes. On the fundus, I look on the vessels, the vein and the arteries, and the disc, margin, the cuff, and the fovea, okay? And the background of the fundus. If I see any lesion, any hemorrhage, but you don't have it, okay? So conclusion for that eye problem, you have the right eyes has a problem, which is 20/70 for visual acuity. And then we need to be for the evaluation by specialist, okay? So now I'm going to inspect and palpate your ear one by one, okay? So first of all, I'm going to do on the left ear to see if you have anything. I can do on the right side first for easy to video. I'm going to do the same thing for the left ear. So I'm going to observe, inspect, and palpate to see if you have any tender, any pain. No pain?
No pain.
No pain. Okay, and no lesions. I'm look on your mastoid bone that you don't have any pain.
Yes.
No more pain. And observe both sides. You have equal, no displacement of the ear on both sides. Okay. Now I inspect the external canal. You don't have any discharge or wax or any hemorrhage or bleeding. Okay. No swelling, no lesions. Now I use the ophthalmoscope to look inside, the internal inside, okay, of your ear. Okay. To do that, because you old, I can pull the ear up and back, okay, to see inside. Okay, and do the same thing on your left ear. Pull the ear back and up. Okay, good. To conclude that, I didn't see any hemorrhage. Okay, no discharge, no wax over there. The temperature on both sides is white shining, and I see the light of the cone of light is normal side. On the left is 7 o'clock position. On the right, 5 o'clock position, which is normal. I also see the landmark of the small bone, what we call incus or stabilis, is normal too. Okay, and now I will test your hearing. Okay, so to do that, I will whisper on the side of your ear. Okay, so you can you conclude? No, occlude one ear. Okay,
Apple.
good. Check, turn it on.
Kitchen.
Good. Okay. So now I'm going to do two tests. We call Weber test. That check your hearing lateralized equal or not. Okay, we call Weber test, and also the Rene test to check the differentiate between the bone conduction and air conduction. Okay. You have equal hearing both sides.
Yes.
Okay, good. Now I'm do the Rene test. Okay. When you don't hear anymore, let me know.
Okay. It's over. It's over.
Okay. Do the same thing on your right ear.
It's over. It's over.
Good. So the Weber test and Rene test normal. Okay. Normal is the air conduction we call AC. Longer than bone conduction we call BC. Okay, which is normal. So now I'm going to examine your nose. I'm going to inspect your nose if you have any deformity. So I see that your nose is symmetry equal, no lesion, no swelling. So I'll take off your glasses, please. So advantage, your nose, any tender, no pain.
No pain.
So I'm going to look at inside your nose, okay, and to see if you have any lesion or any bleeding, anything like that, okay. Okay, so I see your septum is no deviations, but the mucus is a little bit whitish. Okay, there's some discharge in there. I think you have allergy, something, stuffy nose.
Yes.
Yeah, and your terminate also a little bit swelling and warm and a little pale. I think you have a chronic problem, allergy. So also I didn't see any other lesion, okay? And I suppose to test your smelling too, okay? Do you have any problem on your smelling?
No.
Okay. Okay. And now, now I'm going to examine your mouth, okay, and pharynx. I look at your lip a little bit dry, but no lesion, okay? No chapter. Then can you hold me? Okay. So open your mouth. Open it. Okay. I see the gums, no lesion, no bleeding. Your teeth is no caries, no loss, no losing teeth. And and I see your mucus. Your mucosa against your cheek is pinkish, no lesion, and your tongue, the coat is normal but whitish, and then your palliation normal. Can you lift up your tongue, lift up, yeah. Okay, so no lesion. The frenulum is normal, no lesions, and I saw the saliva. They're wet. This means your salivary duct is potential, and okay, open up again. I observe your palate, the heart, the sub palate, and the uvula is normal, no lesion, no discharge. Open up again. Say R. Okay. So your uvula and your palate is raised up, equal size. You don't have, I didn't see any tonsil swelling, and no lesion, no discharge. The posterior wall of your pharynx also no lesion, no discharge. Okay, and no bleeding. Okay. That concludes your mouth and your pharynx examination. Is it normal? Now, I'm going to examine your lymph node to see if any swelling lymph node, and if it does, I have to identify if the lymph node is movable, tender, or the size. Okay. First, I will palpate. This is become pre-auricular lesions.
Regular.
Yeah, but no lymph node. Post-auricular, no lymph node.
Regular.
And now, this is the tonsil, no swelling. Submandibular, sorry, normal. Submental, normal, no lymph, yeah, no lymph node. Now, so for the cervical, we have superficial, anterior, and posterior. Superficial, no lymph node. Deep cervical, no lymph node. Posterior, no lymph node. Okay, supraclavicular, no lymph node. Infraclavicular, no lymph node. Okay. So for the axillary, central, lateral, posterior, anterior, no lymph node. Trochlear, no lymph node. Okay. So for inguinal, I will examine later. Okay. Now, that conclude the lymph node examination is normal. Okay. So now I look on your neck. So your windpipe, your trachea in the middle. I didn't see any lesion. Okay. And now, okay. So I have a cup of water here. You can swallow. Then I can examine your thyroid. Okay. When I take a sip, but don't swallow yet. Okay. Okay, go ahead, take a sip. Swallow. No, swallow. Okay, do it again. Okay, good. So your thyroid, no enlargement, no lymph node, no tender, no pain, right? Yeah, okay. Now, I'm going to do the examination of your lung. So observe your lung. Can you take up your t-shirt? Take it up. Yeah. So you have normal symmetry. I didn't see any lesions. And observe the ratio of the anterior, posterior, and transverse diameters, which is the ratio of 1:2, which is normal. And then I see the you don't have any effort of accessory respiratory muscles, okay, which is normal. So now I'm going to percuss on your back, okay? Turn around. To percuss that, I'm going to find out if you have any dull sound or the resonance, okay? That's the resonance, okay? Okay, so you see the dull here, which is the level of diaphragm, okay? Okay, so take a real deep breath in. Hold. All right here, okay. So again, breathe it out again. Breathe in, hold. Okay. So after you breathe in, the level of the diaphragm go move down, which is about 3 to 4 centimeter. Okay. So breathe normal. Breathe in, breathe in, out. Again, in. Okay. This is normal. Okay. So now, hold on. I'm going to do the osculate your lung to see if you to hear the breath sound or any adventitious sound which is abnormal. Okay, in and out, in, 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 out. Okay. So, no, yet. So you have a normal breath sound. I didn't see and I didn't hear any activation, which is wheezing or rail. Okay, wheezing is the high pitch of a sound when just like a sound going through the narrow tube. Okay, and the rail just like when you rub the hair like this together, so you don't inhale that sound in your lung. Now, I'm going to do the tactile free matrix, which is the intensify of your conduct sound from your throat going to your lung if you have any fluid in there. Okay, just say 99 for me.
99, 99, 99.
Okay, that's good. Now I'm going to look again. We find out if you have bronchophony. Say 99 again. Okay.
99, 99, 99, 99, 99, 99.
Now you say E. Okay.
E, 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 E.
Okay, good. All right, you can put it on. Okay, so the bronchophony is mean the same thing. Normally I will hear you when you say 99. It's a long distance. I can hear well. The sound you say 99. But if you hear clearly 99, it means you have the fluid in your lung. So that means conduct the sound very well. I can hear well, but you don't have like that. Okay. The same thing for egophony. When you say E, normally I hear with A. Okay. I didn't hear well the sound E. Okay. I can hear well if you have fluid, something in there. Okay. In your lung, but which is normal to you now. Okay. Now, can you lay down? Yeah. No, can take off again. Sorry, take off. Okay, and lay down. Okay. I'm going to observe your chest to see if you have any hip or lip, which you don't have it. And then I will bandage your chest to see if I feel any thrill if you don't have it. Okay. Okay. Good. Now I am osculate. No, I want to feel your BMI. So your BMI on the fifth interspace on the midline of your left clavicle line. So let me count the rate. It's around 78, and intensity is normal and regular. Okay, now I osculate your different area. Okay. So I'm going to hear back with the bell. Can turn on the left. Turn on the left. Yeah. Okay. Sit up. lean forward. Okay. Put it on. So I hear on different locations which we call aortic, aortic area, which is on the second space on the right border of the sternum, and the pulmonic area on the second space on the left border sternum, and then go moving down on the third or fourth space on the left of the border of the sternum, we call a tricuspid area, and then on the midline of the clavicle left line, it's going to be the mitral valve. Okay, on the tricuspid mitral valve area, we hear S1 and S2 clearer than on the aortic and pulmonic, which we can hear the S3 and S4. And then I do some manipulate on you to the left or lean forward to find out if I can hear any abnormal murmur. Okay, you don't have any murmur. In case you have murmur, so we going to identify the location of a murmur, the intensity, the big pitch, and the radiation. You don't have it. Okay. So now I go. Now I'm going to examine your pulse on both sides. Radio, which is present, normal, about level 2. Ulnar. Okay, brachial. Okay, popliteal. Equal, normal, level 2. Hey, can you take up your shock? Okay. And then back your dorsal pedalis, equal, normal, and posterior tibialis, equal, normal. Okay, now you can lay down. Okay. Okay. Yeah. Now I can bend back your femoral, equal, normal, and then level 2. At the same time, I'm going to bend back if you have any lymph node. You don't have lymph node. Now, stay there, okay? Just lay there. Now I move on abdomen. Can you pull back your shirt? Just pull back your shirt, yeah. I'm going to see the abdomen. Okay, relax. I observe, inspect abdomen, and I don't see any lesion, no scar, and no protrusion, and the umbilical is normal, and no palpation I can see. Now I'm going to oscillate for 4 quadrants. Okay, right upper, left upper, left lower, and right lower quadrant to hear the bowel sound. Okay. Okay. So the normal bowel sound from 5 to 35 times per minute. You are in the range, normal. Okay. So on oscillate, I also want to listen the fluid on the aorta and the renal artery. So you don't have a fluid, okay? So now I percuss on the 4 quadrants of the abdomen also to find out if you have tympani and you have dough, okay? Tympani is the air in the abdomen, in the intestine, dough sometimes because of the fluid there, and then the food we eat, okay? And on the percussion, I also find the span of the liver, okay? So this is tympani, okay? So it's normal, okay? So I'm going to move back, right there. Okay, down right here. This is the lower edge of your liver on the midline of the right clavicle. Okay, so I'm going here, I'm going down from right here. Okay, so it's about 8 centimeter span. So it's the normal range. Okay, normal from 6 to 12 centimeter. So you have a normal size of the liver. Okay, so now I'm bandaged. Okay, I'm going to do the light band back first. If you have any pain, any tender, let me know. Okay, so no pain, no tender. So I'm going to a little bit deeper. Okay. So no mass, no tender. Okay. So I try to band back your lower. Breathe in, breathe in. Out. Again. In, out. Okay. So no. Okay. So I'm band back on this side. If I feel any enlarge of the lower edge of your spleen, you should know. Then okay. 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 If the spleen enlarged, you're going to normally it's on the anterior or midline of the axillary line here. But if I feel over this, and then this means enlarge of the spleen, but we don't have. Okay, so I don't feel any enlarge or pain of the kidney neither. Okay, okay, and I'm going to do the special test. Okay, we call rebound tenderness. Okay, this means when I'm going to dip and I will release, suddenly you will feel pain, but I don't see any pain on you. Okay, okay, so it's normal. So no rebound tenderness. So now can you lift up your hand? Your leg, lift up. So lift this. Okay. Any pain? No. Okay. So this is the SOIS test. It's negative. So I'm going to do this. Any pain? No. So this means I just do the obturator test. Okay, this means I do the internal rotation of your joints. You don't have any pain. So I press here. So any pain? No pain nowhere. So that the rope inside, you don't have any pain either. Okay. So now you sit up. Stay there. Stay there. I'm going to do the CVA test. Any pain? No. Okay. So it's to test that for the kidney infection or any pain swelling that you don't have. Okay. Now I'm going to do away. Yeah. Now I'm going to examine your muscular system. To do that, I'm going to inspect band back and identify the landmark. Okay. First of all, I'm going to touch your TMJ. The joint. Any pain?
No pain.
No pain. Okay. 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 Turn around this way. I'm going to bend back your neck. Okay. No tender? No? Okay. Can you touch your chin in front? Touch your chin like this. Okay. Extend. Look. Extend your neck. Okay. Touch your ear on your shoulder like this. On this side. And turn your right. And turn the other side. Good. So you don't have any problem on your cervical. Okay. Let's see. Okay, inspect your shoulder. I'm going to do the same thing on your right. So your AC joint, glenohumeral normal, and this is the bicipital groove normal. Okay, good. So now I'm going to inspect your elbow. This is the apitrachal, both sides normal, oblique rodent normal. Okay. Now can you flexion, extend. Okay. Pronation, supine. Okay, all range normal. So I inspect your wrist. Okay. So I touch the landmark. No pain, right? This is the radial and ulnar styloid, normal, right? No pain. Okay. I'm going to touch the carbo bone, normal. Okay. Now, can you flexion, extend? Okay. Deviation on this side or this side. Okay. No pain. So let's see. Inspect your hand, phalangeal bone. Okay. And this is the MCP joint and the PIP joint, DIP joint. It's normal. Okay. Now, can you flexion, extension, abduction, abduction. Okay. Now, can you touch your position? Okay. Your thumb extension. Okay. I mean abduction, abduction. Good. Now, going to do the same thing. So you have normal. Okay. Can you? Okay. Let me see. For your knee, I touch on the. This is on the lateral, femoral, lateral, condyle, internal, medial condyle, tibial condyle here, no, tibial, okay, medial and lateral space joint, no swelling, no pain, and patella, normal. Okay, now can you extension, yeah, flexion your knee. Flexion your knee. Yeah, extension, flexion. Okay, good. Now, I am going to touch your ankle. This is malleoli, internal, medial, and lateral, malleolus. No pain. Okay. And tarsal. Okay. And tarsophalangeal. MTB, PIP, DIP. Okay. Now, innotation. Okay. Now, can you extend flexion? Okay. Inversion, exversion. Okay. Good. And then abduction. Okay. We're going to check the same thing. You are normal. Okay. Can you lay down? Okay. Now I'm going to palpate your radar to center. No pain?
Pain. A little.
No pain. How about this? No pain?
No pain.
This one? No pain? Okay. Now I'm going to, okay, flexion, extension, okay, abduction. No pain, right? Abduction? No? Okay, good. Okay, sit up. Now for the for the nerve examination, I'm going to examine 12 cranial nerve. Okay, for the first one that instead of I examine the smelling you feel, but you say you have smelling normal. We don't have a smelling here, but anyway, you say normal. That's me cranial 1 normal. Okay, cranial 2 is for visual acuity and then visual field, which we already test. So you have a problem on your right, okay, eyes. So that we test for cranial number 2, okay. For the number 3, number 4, and number 6 of your cranial nerve, we only test your movement of your eyes, okay. So and then the eyelid raise up is for cranial 3, and on different days. So you have 3, 4, and 6 in normal. Okay. Number 3 is mid-ocular motor nerve. Number 4 is trochlear nerve. Number 6 is lateral ocular nerve is in normal. So now is for number 5, trigeminal nerve. Include the sensory test and then the movement test. Okay. So to do that, I'm going to test your feeling. Okay. Can you take out your glasses? Get up. So this feeling like this is sharp, this is dull. Okay. So close your eyes. Dull or sharp?
Dull. Sharp. Dull.
Okay. So this is normal feeling. Okay. Now, can you bite, clench your, okay. That means I check your your masseter and the muscle, okay, for the cranial 5 is the normal, okay. So now cranial 7. So can you raise your eyebrow? Okay. Frown. Good. Show your teeth. Okay, good. So this is cranial 7, normal, okay? Now cranial 8, I only test your hearing, which is normal. Cranial 9 and 10 we call glossopharyngeal or vagus nerve. We already test here when I test your mouth, your pharynx. I tell you raise up. I say so the symmetry raise up of your uvula and the subpalate is normal. Okay. So now for the cranial 11, we call accessory nerve. So, can you shrug? Okay, I guess do it again. 1, 2, 3. Okay. Now turn your head on this side, No, against my head. No, turn your head. Yeah. Okay. This side. Okay, good. So that shows your cranial 11 normal. Stick out your tongue. Stick out. This side. Yeah. Okay. So cranial 12 normal. Okay. Now, I observe your muscles. I see the tone and the bow is normal. Okay. Now I'm going to do the strength. Okay, the strength of the muscle. I'm going to do the on the hand and on the leg. Okay. So can you do this? Okay. Don't again. Okay. I pull you, but you don't let me pull you. Don't let me pull you. Okay. Okay. Push out. Okay. Good. Put out. Okay. Put it in. Good. Okay. Now raise up your leg. Raise up. Okay. This one. Raise up. Okay. Okay. Push me. Okay. Pull back. Okay. Lift up. Lift up. Pull back. Okay. This one. Lift pull back. Good. All right. Now I'm going to do the sensations on your arm and your leg. Okay. Do the same thing. Down and sharp. Okay. Close your eye.
Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. 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 Sharp.
Good. So if you have a normal sensation, okay? Now, I'm going to do the reflex, okay? I'm going to do one side, another side we do the same, okay? This is the bicep, okay? And this is the tricep. Okay, good. This is the brachioradialis. This is the reflex patella. Relax, okay? Okay. This is Achilles. Good. Now I'm going to do the, okay, that we call voluntary response. All Babinski test, you don't have it, okay? That's good. Now, if the infant, I'm going to do some more reflex. We call moral reflex, which means the startle of the kid. I just try to explain to you, okay? Moral reflex, which is when you let the infant lay on the table, you pull the hand and you suddenly drop down the baby, then the baby will startle, and all the arm will be extend and then up that, and then on the hand will be fan out, okay? So that's like suddenly startle, okay? And then we can do tonic neck reflex, rolling when you touch on the cheek, the baby will turn over, or you show on the lip. It's just the baby will reflex sucking, like sucking the milk, okay? And then also we can do the palmar. We touch on the palmar or the plantar. The baby will hold your hand, okay? Or we can do the parachute. It means like people have a parachute from the sky, and then we put the baby, we hold a baby pronation, and we put down, suddenly put down, all the extremity will be extended, okay? And or we can do the trunk incubation. we just touch the baby on the side of the trunk, and one side of the baby will turn over. Okay. Usually on the infant reflex will disappear by 6 months, but it extends more than 6 months. So somehow the nerve problem we have to do more detailed study. For Pediatric, it's forever. Okay, and or we can do the we call blessing or stepping. This means we hold the baby standing out and touch the feet of the baby on the edge of the table, and suddenly the leg will flexion and step on the table. That is some reflex in the infant. Now for the nerve, I would like to check your cerebellar function. Okay, that includes the equivalence test and the coordination test. Okay, so to do that, can you use your finger, okay, touch my finger and touch your nose. Okay, do it. One, your nose. No, use the same finger. Your nose, my finger, nose, my finger, your nose. Okay, do the other side. Yeah, my finger, nose, my finger, nose, my finger, nose. Now, another test, we can do the alternating movement. Okay, like this. Do fast. Yeah, good. That's it. That's enough. Now, check for your lower extremity. From here, going down, back, down, like this. Yeah. Another side. Very good. So, okay, now we're going to do, can you stand up? Okay. Okay. Stand over there. Walk to me. Walk normally. So that's it. Turn around. Okay. Can you walk like hip toe like this? Okay. Very good. Okay, that's it. That's enough. Now, can you? We're going to do the rumble test. Okay. So it means you have to close your eyes. Not yet. Listen. Close your eye. Extend your arm. Okay. Listen. Okay. And pronation your spine, your arm. I mean your palm. Okay. Do it again. Okay. Stand. Spine. Yeah. No, do it until I still stop. Yeah. No, just do it like this. Hold it. That's good. Okay. So you don't have pronation drop of your arm. Will be okay. It's normal. Okay, have a seat. Okay. So we finish. We just finished all examination. Okay. Conclusion. Everything else normal. You just have a allergy reaction on your nose, make your nose have a discharge mucus. Okay, the mucosa look pale in there. So we go, and then also you have a right eyes problem. Okay, so we're going to refer you to ophthalmologist to do further examination, and then maybe the allergy specialist to do the test for you. Okay, so that's it. Thank you. Dean, I forget to talk. Okay, so just stay back here, and then I'm going to check your parotid gland. Okay, on the examination of your mouth, I want to see the parotid gland, any pain, any swelling, but you don't have. Okay, so now for the muscular examination, I forget to check your spine. Now I want to go back. Okay, so can you stand up and okay, let me see here. So your spine is straight, no deformity. Okay, and no tender, vertebral muscle, no pain, no tender. Okay, and symmetry. Now, can you bend over your trunk? Bend over on the way down. So, okay, I see symmetry and equal on both sides. Okay, stand back. Now I'm going to touch your sciatic knot here. There's no pain. Okay. So on the spine examination, I didn't see you have any kyphosis, scoliosis, or lordosis. Okay, so which is normal. It means deformity of your spine. Your spine doesn't have that kind of deformity. Okay, so conclusion on your muscular examination is normal. Thank you.